Good afternoon, Rachel. Thank you for joining us here at the Integrated Care Board. Can you tell us your name and job title and role on the board, please?
Yes. So I'm Rachel Wigglesworth. I'm the Director of Public Health, covering Cornwall and the Isles of Scilly, and I'm a participant member on the ICB here.
Brilliant stuff. And today we've had a packed agenda, and I want to talk to you about a few things. First of all, is about every board meeting we share a series of what we call vignettes, which are basically films of either people from our public or our staff. And today's theme is all about research, which I know you're really passionate about. And we heard some great examples today about innovative projects that are underway to support local people, but also the motivational factors from our GPs of getting involved in research and how they're actually making a real difference in advancing some of our healthcare. What did you think about some of the films we saw?
Yeah, I was really impressed by the range of examples that were in the videos that we heard today, because it was people that are involved in the research itself, some of the staff, the clinicians. And I think the more that people get involved in research and sort of improve practice, then it's better outcomes and quality for everyone. But some real sort of passion for research, and the range of examples covered, from hospital down to local practices, and also the health determinants research that we lead in public health, looking at making sure that research is embedded in decisions. And I think that's important for the board to be using the decisions based in evidence to improve services.
I know there's been wider work that's happened across Cornwall to try and increase the uptake of people who perhaps are facing the most health inequalities into research, because that's going to have a benefit for many, both us in terms of the NHS and staff, but also the public who will get involved.
That's right. Often research is undertaken in people that are easier to engage with and not always representative of the whole population. So the more and different groups that are engaged, the more evidence that you have and experience of people with different backgrounds and different characteristics.
Brilliant. And we'll be putting those films on our website, and we'll be doing some longer term work to try and raise the profile of the great research that's happening in Cornwall, and also to try and get people to sign up to research programmes so they can be part of something great in the future too. One of the other things that we discussed at board was the importance of equality, diversity and inclusion, and there's an action plan that's going to be underway, which is all about looking at how do we recruit more accessibly and more diverse into our workforces, but also how do we support our populations who are facing health inequalities. And obviously in your role as Public Director for Health, it's all about making sure that we're helping and supporting people facing health inequalities. What type of things are people facing in Cornwall and the Isles of Scilly?
So there's lots of people that experience different types of health inequality. I had a Director of Public Health annual report which went into some depth describing some of those experiences in Cornwall. But people who have a lower income or in general do experience worse health for lots of reasons, about whether they have poor housing or low income. But they experience things like a shorter life. So there are some sort of really key differences, 7 years of difference in the length of life that is lived in certain groups that are the most deprived compared to the least deprived communities. So some really stark inequalities, but not just income and not just where you live is important. There's also your particular characteristics. So if, say, you've got a disability or there's gender differences or ethnicity or sexuality. So there's some groups that consistently have barriers to accessing health services, or in terms of how their life opportunities or combination of experiences through their life might lead to sort of poorer health outcomes. One example is people with a severe mental illness, who for a lot of experience of their life might have disadvantage, might have a lower income as a result of their disability. They tend to, have a much significantly shorter life expectancy, and that's really unfair. And part of the considerations of the board should be really addressing how to equalise and address that gap and reduce it in Cornwall.
And I know that there's lots of great work that's happening across Cornwall and the Isles of Scilly to try and help and support people. I know there's the CFIT initiative, which is connecting with our fishing communities. There's great work to connect with our farming communities. Is there any example of projects that you want to tell us about?
Well, I think that this should be embedded in everything we do. So I guess it's not just about projects, but about how the system sort of works together to make and address the differences in access. So I think we can think of targeting sort of particular interventions in geographical areas of Cornwall that giving examples of. But I think we need to be thinking of it as a whole system approach rather than sort of some singular projects and address that across a whole variety of our partnerships.
I think that's really important, isn't it? That we actually just think all the time about how can we make sure our services are equitable to those who most need it. Yeah. We also talked about two important sort of connected areas, which was the critical incident that was declared in January. And this is what the NHS, I suppose it's a sort of definition, but when a system is very, very pressured and health and care services are particularly busy, it's about how do we bring everyone together to make sure that we get our patients into the areas of care that they need, and everyone worked really, really well together. And our chief exec gave a big thank you to staff across the NHS, also in our GP practices, primary care, across our ambulance service, and of course the council. How important is it that we work together to deliver health and care services, do you think it is?
Oh, it's absolutely essential. And I think that's what the board's working shows, is that there's got to be a collaboration. And the response today, I think, really congratulated the way in which agencies work really positive together, whether that's social care, supporting people, prevent them to going into hospital, whether it's the voluntary sector who give really practical and important support in our whole range of ways and practical ways, but also in the public health way of preventing people from having poor health in the first place, and preventing and reducing and delaying the need for care. So it needs to be a partnership approach. We need to all work together to sort of keep people well longer, rather than always having to face the crises that we do see when we go into critical incident about the front of the actual services in emergency care that we see in our hospitals. So absolutely needs to be a joint approach, and I see really positive working over the winter together. Some examples in preparation for winter, I think, have been very successful, trying to promote access to keeping people warm and preventing infectious diseases that we know are around in the winter periods, the norovirus, the respiratory illnesses, and promoting vaccination to prevent those illnesses occurring in the first place. So a whole range of work that I think's helped the system, do the best it can.
And the winter's not a surprise for us. We do lots of preparation and planning. And I know your team in particular, working with us at the NHS, has been doing lots of work around winter wellbeing. There's a fantastic booklet that's been going out about right early on in the autumn. That started going out, the vaccination programme, as you mentioned. And obviously, we're still encouraging people to get vaccinated because what they're calling the quademic, which is the flu, the COVID, the RSV, respiratory, and also norovirus, is really having an impact still. So people can still get a vaccination. But for you, it's about looking ahead, isn't it? It's about planning and delivering so that we are stopping people early on in getting ill in the first place.
That's right. And I really encourage anyone who might be vulnerable to these illnesses to really take up that offer, because there's still, not everyone has done that. And we know it's really effective in keeping you well over the winter. If you can prevent getting respiratory illness and potentially pneumonia, it's really nasty to recover from. So encourage people to do that. But the other side of it, in a public health perspective, is really keeping healthy, and all of the things that you can do to keep well, to really, help you enjoy your life, whether that's your mental well-being and being active, preventing sort of ill health like diabetes, do a good diet. So there's a whole range people can do for themselves, but it's also the support we give to give information and help people know where to go if they do need help is important.
And lastly, the board heard about our performance, and we hear every month how we're doing. And there are always areas that we could do better in. But it was interesting to see some good performance in some of our new initiatives that have been up and running for about a year now, such as our virtual wards, an increase in people receiving hospital care at home, people getting home from hospital sooner. And I know you were guest speaking at a very important and interesting conference earlier in the week about our how to support our ageing population to live better, independent lives as they get older. How important is it that we try and keep our older people out of hospital in the first place?
I mean, I think the conference itself, where Chris Whitty spoke and talked about his report on healthy ageing and how to make a place like Cornwall as age friendly as possible. And I think what we heard from people who spoke at the event, people who live here, and the many people who are staff who also will grow older, we hope, healthily in Cornwall, just really key to enjoy your life. The quality of life is really an important part, not just extending how long you live, but how long you spend in really good health. And if you keep active, social connections, have a place and a community that supports you, it really helps that to happen in later life. And it's not just your health, but also transport, getting around, participating, and reducing discrimination as well for people who are in later life. And people sometimes want to carry on working, and everyone wants to carry on contributing to society. So all of those elements were discussed.
And like many things in life, we're all going to get old, aren't we? And we want to create a place that we love and want to grow older in Cornwall and the Isles of Scilly. Thank you very much for your time today, Rachel.
Thanks, Stacey.
Thank you.